Good morning. Welcome and thank you for joining us for our Northern Light Health, Good Health is Good Business Zoom conference. COVID-19 is still on our radar screen, and Monkey Pox is too. We'll provide an update on both. Mental health has been an integral part of business management during the pandemic. We'll look at options to address the mental health of your employees. I'm Dr. Ed Gilkey, Senior Physician Executive at Northern Light Beacon Health. I'll be your moderator for the next hour. Our panelists today are Scott Mckee, Managing Partner at Acadia Benefits, Jamie Audette, Vice President of Human Resources Operations and Rewards at Northern Light Health, Sheila Thibodeau, Director of Operations at Northern Light Workforce Employee Assistance Program, Dr. Jim Jarvis, Director of Clinical Education at Northern Light Eastern Maine Medical Center and Senior Physician Executive of COVID-19 Incident Command at Northern Light Health. Before we get started, I will read our legal disclosure. The coronavirus pandemic is an ongoing, continuously evolving situation. Northern Light Health encourages everyone to follow federal and state governmental guidance and mandates. Northern Light Health does not know the particulars of your situation, so the information presented today is general in nature and is based upon Northern Light Health's own experience, which may or may not apply in your specific situation and which may be revised as we learn more about the coronavirus. Accordingly, following any guidance Northern Light Health presents today in no way guarantees that you, your employees, and/or your customers and clients will not contract or spread the coronavirus. A reminder, this hour is for you. If at any time you have a question for our panelists, please use the Q&A function. I'll keep track of your questions and have our speakers respond. Also, I hope each of you will take a few minutes immediately following this hour to answer our quick 5-question survey. Your input directly affects our topics and helps guide our future conferences. Dr. Jarvis will start us off with the latest on COVID-19 and Monkey Pox. Dr. Jarvis.
Thank you, Ed. I think I sound like a little bit of a broken record because most of what I've talked about the last few months continues to be the same thing that we talk about now, which in some ways is a good thing because it says that we're kind of in a more stable situation. So I really wanted to give a quick update as to where we are across the country and particularly in our region in terms of the amount of cases that we're seeing per 10,000 in our areas. And so if we look back on July 31st, New England looks very much in the yellow-orange category, which puts us really in the lower portion of the number of cases that we're seeing on a daily basis. But you can certainly see there are some very dark areas around the country back then. If we looked at just a few days ago, some of those dark regions have actually lightened up a little bit, and New England remains in a very good area. And if we look at what projections are supposed to be for the next couple of weeks, it does seem to state that New England will stay in this stable kind of numbers that we've been seeing. But there are a few more hotspots that are on the horizon around the US, but for the most part, it looks like we're headed in the right direction. I will put a word of caution about that because over the last few months, our predictive models have been very varied and a little bit difficult to determine because of the ever-changing situation in terms of variants with the virus that causes SARS-CoV-2 or COVID-19. Next slide, please. So if we look at the community risk level, so that takes into account the number of cases that are in a particular community and the ability of that community to respond to those cases, particularly in terms of hospitalization. We once again see that New England is doing very well. And for the first time in a long time, every county in the state of Maine is now in a low-risk area. Again, I put a bit of caution to that simply because this only takes into account the ability of hospital capacity for COVID patients who are infected with COVID-19 and not the overall hospital capacity. As we've talked about before, during the summer months, our hospital systems and independent hospitals across the state are often very strained for capacity because our population sometimes can increase tenfold due to travelers and tourists coming in and out of the state. And so hospital capacity is still at risk here in the state of Maine, despite the fact that our community risk level for COVID is low. I again put the caution out there that COVID-19 is still spreading pretty significantly in our communities. A quick update on COVID vaccines. Currently, a primary series for vaccination is now authorized and recommended for anyone 6 months and above. A first booster shot is authorized for anyone 5 years and older. A second booster shot still remains for people who are 50 years of age and over, or anyone who is over the age of 12 and has an underlying condition that puts them at risk for severe disease. We do expect that there will be targeted vaccines coming this fall that will likely include authorization for a second booster for everyone who is 12 and older, and a third booster for those who are 50 and older. These targeted vaccines are going to be specific towards the Omicron variants that we see circulating around the world right now, particularly the BA.5 and BA.4 strains that are the dominant strains not only across the United States, but here in Maine. Next slide, please. I did want to talk quickly about some other health concerns this time of the year. The first and foremost is heat advisories, and particularly if you're in an occupation where you may be working in a very hot environment, such as in a kitchen or in a factory where there is a lot of heat generated by machines. So please watch out for your employees, making sure that they stay well hydrated, and look for signs of heat exhaustion, which would include fatigue, excessive sweating, just not feeling well, headache, or frankly, heat stroke, where actually that compromises some systems within their bodies. So please make sure that your employees are taken care of. I really want to touch quickly on Monkey Pox. To date, there have been 3 confirmed cases in Maine. It still is a very limited risk to the general population. This particular strain of Monkey Pox really requires direct contact with an individual and the rash that the Monkey Pox causes. There's very little transmission outside of that particular case. We do have vaccines and antiviral medications available here in Maine for both individuals who are confirmed to be infected with the virus and those who have been close contacts with those individuals. If there's any suspicion or suggestion that somebody might be infected or they have any concerns, I recommend that people reach out to the Maine CDC or look on the Maine CDC's website. They have excellent information on monkeypox, including for those individuals who are at higher risk due to certain risk factors. And then my last slide is really just a general slide that shows where you can go for public vaccinations right now for COVID-19. And then Ed, I believe you had a few questions for me.
I do, Jim. I'm going to start with COVID, just to kind of clarify. I think you did a great job in the community risk level and the explanation of that. And that's always confusing when you see the map of transmission, and the transmission has a whole lot more red on it across the country. So this is really still being transmitted very significantly, is my understanding. Is that correct, Jim?
It is. In fact, actually here in the state of Maine, we have a positivity rate, meaning in the number of tests that we get done, how many of those are positive, that is still a significant number. Depending on the area, it is running somewhere between 7 and 11%. That is significantly high. Those of you who've been on these calls since the very beginning, remember that I used to say that if we had a positivity rate over 1%, that's significant cause for concern. And obviously we're 10 times that still. At some points, we have been more than 20 times that trigger mark for us to be concerned. So there is significant spread of disease out there. The good news is that most people continue to have mild symptoms with these particular strains. However, it still puts a strain on our economy, our ability to have our kids stay in school. And so it still is important for us all to protect ourselves and, more importantly, protect the communities around us.
So last fall, we saw Delta, take over the situation. Then after Thanksgiving, Omicron, and we are still dealing with the subvariants of Omicron. BA.5 in just a short period of time is at 86% dominance in America. It's just very impressive how that accomplished. And now we hear about BA 2.75 floating out there. I love putting you on the spot by consulting with your crystal ball. All things considered, what do you think the fall winter will look like for COVID?
Yeah, unfortunately, my crystal ball is pretty cloudy these days. As I said, it's become harder and harder for us to predict what's going to happen even in the next few weeks, let alone months to come. I still worry about the start of the school year and what that means for us going forward. As we know, here in Maine, the school year means that we have more people that are congregating together. And then colder weather, unfortunately, will start stepping in as we head into fall and then into winter, which means people will be indoors more. And that's a great setup for us to just have a higher transmission than we're currently seeing during our wonderful summer months. Also, as you stated, there are other variants of concern out there. Right now, they have not posed a significant risk here in the United States, but that could always change very quickly, as we saw with the original Delta, the original Omicron. They can take hold very quickly. And then, as you said, the BA.5 variant really became the dominant strain in a very short amount of time. And that could happen with some other new mutation. That's the concern that we continue to have with COVID-19. The virus that causes it is mutating at a much faster rate than we've seen with similar viruses in the past. And if it just happens to be that we get one that's more infectious and causes more severe disease, that sets us up for a bad winter. Hopefully that won't happen. And the more people who get vaccinated and the more targeted booster shots that we're able to develop will help prevent that from happening.
Do you pay attention to COVID every day?
I actually do. Yes.
Yeah, so do I, just so that our audience understands that. I mean, this is not in the rearview mirror yet. I'm going to switch gears just quickly to monkeypox. I got a couple quick questions on that.
Sure.
First off, we understand that the World Health Organization, and then followed, I don't know, several weeks to maybe as much as 2 months later, the U.S. has declared monkeypox a public health emergency, which, to my understanding, releases resources. It's almost a sort of an emergency plan approach to it. But it also captures our attention in that the government is taking it serious, that monkeypox is not to be ignored. So let me just ask you a blunt question here. Do you see monkeypox becoming another pandemic like COVID-19 for everybody to deal with?
I don't, and the reason being is because of the way this particular variant of monkeypox is being transmitted. If it was to become something that was more likely to be spread either by respiratory droplets or respiratory secretions, meaning when you cough, that's stuff that comes out of your mouth and nose when you cough and sneeze, that would cause us a little bit more concern. There is some strains in monkeypox that's more likely to happen, but not this one that currently is causing the worldwide situation that we have. So that's good news for us. It really is a direct contact with the rash that causes the spread. And so hopefully that will stay the same. It's good news that we did declare the emergency, because then that, as you said, sets us up for preparedness, releases some resources so that the company that makes the vaccine and the antiviral medications that treat this can rev up kind of productivity in case we need to have more than what we're currently administering. So that's a welcomed news for those of us that deal with public health. Again, right now, the general population, particularly here in New England, because the number of cases is low, remains very, very low risk.
Mm-hmm. Do people die from monkeypox?
With this particular strain, it's rare that people die from monkeypox, but we've heard anecdotally from individuals who have unfortunately contracted this particular virus. They say that it is an extremely painful, unpleasant experience once the rash develops. And so that's the reason that they're having so much trouble in some of our larger urban states, where they have far more individuals who are contracting the virus, and they are seeking healthcare simply because of the pain of this particular thing. I am not aware of any reported deaths from monkeypox here in the United States. There are some other variants of monkeypox that frankly are still very, very, very confined to the African continent that do have a higher mortality rate. But again, it's still rare. It's not like smallpox, which is a cousin of monkeypox.
Mm-hmm. Okay, well, thanks for all that information, Jim. I realize this is an evolving situation, and we'll certainly visit it again next month. So thank you
Ed.
for all that
Appreciate it.
info. Okay. Well, let me set the stage for our next segment. Mental health is very costly. The direct costs are fairly obvious and related to the cost of diagnosis and treatment. The indirect costs are often hidden. Absenteeism, for instance, is calculated to cost 7% of global payroll. As another example, depression adds 26 missed workdays per year. Presenteeism is even more hidden and difficult to calculate. It is estimated at 3 to 4 times the impact of absenteeism. The most discernible component of presenteeism is lower productivity. Mental health issues are also a driver of higher employee turnover at twice the rate of employees without these issues. The cost of replacement plays a significant role as well and averages 33% of salary. Other medical costs are also impacted, with claims at twice the cost for the people affected with mental health disorders. Hidden costs are additionally driven by lack of diagnosis and treatment. These missed opportunities are due to denial, fear of job loss, ongoing stigmatism related to having a mental health disorder. In fact, 1 in 4 Americans are impacted by mental health disorders. Unfortunately, mental health issues are frequently hidden disorders. The related hidden costs quickly become staggering, measured in the billions of dollars in the United States. Studies have demonstrated that the return on investment from managing your employees' mental health disorders ranges from $2 to $4 to 1, an excellent ROI. This quote from Lori Tenney at CVS Health sums it up well. When employees come to work, they don't leave their mental health troubles in the car. These troubles are real, often hidden, and advantageous to deal with. So let's deal with them. Our next speaker is Scott Mckee, a troubles dealer and solutions finder of notable reputation. Scott works with businesses to guide them to appropriate benefit plans for their needs. He will help us take a look at what Maine businesses need to support their employees. Thanks, Scott, for coming, and you're up.
Thanks, Ed. So our team works with employers across the state to build benefit programs that support their team members and families. In the past 2 years, we've seen our customers struggle with a shrinking, disengaged workforce, multiplied by a reduced connection to employer and mission. Employers in all industries, healthcare, education, others have seen their teams challenged to thrive with the new reality. We're watching employees, we're witnessing stress in our workforce, absenteeism, and reduced productivity that Dr. Gilkey mentioned. The bottom chart on this slide shows that prior to the pandemic, many patients were not getting treated for their mental health conditions. Due to COVID stressors, anxiety, our new reality, the demand for mental health care has increased over the past 3 years. The Kaiser data in the top chart highlights the number of adults that have the growth of adults that report needing care, mental health care. Employees looking for mental health services are finding traditional programming, visit limited EAP, in-person counseling through their health insurance plan, falling short as a solution, mostly due to access. To address the evolving struggle of access, employers, our customers, are searching for and deploying new programs, new resources. Virtual care available from maybe your insurance plan or as a standalone offering. Mental health and well-being content, could be a webinar, could be a class, could be a seminar. App-based programming, maybe podcasts, app-based meditation, team challenges is available. Capitation-based healthcare access is available to employers today. Employers are transitioning from a visit limit EAP to a course of treatment care and providing that resource to their employees. And then providing access to care to all employees, not necessarily tied to employees that are signed up for their health insurance plan. And then we also see employers deploying low cost or no cost perk type offerings, maybe a lifestyle management program, a lifestyle account program, sorry, where employers will offer to reimburse folks for a portion of their cell phone bill or a Netflix account or a certain amount of money every year towards a HelloFresh account, letting employees choose a reimbursement program that really fits their needs individually. We're seeing employers look at emergency savings accounts, discount programs, maybe other benefits that we call thank you benefits, where employees, a low-cost program or a no-cost program, just to get employees to say, hey, thanks, that's great that you're offering that to us. And maternity, paternity leave is an example of that. So these are the resources that our customers are looking to us to support and deploy for them.
Thanks, Scott. Jimmy Audette will now provide insight into why investing in your employees' mental health is good business. Jamie?
Thanks, Dr. G. So the first thing that I want to really stress today is that being well means something different to everybody. The second key point is that mental health is supported by things that aren't specifically targeted to behavioral health. So examples of that are having a good paid time off program. It gives you time to charge your batteries. Physical activity is huge for assisting with mental health issues. Having income protection from a good short-term disability offering from your employer provides you peace of mind with your finances. So those are what I call indirect supports, but they're incredibly important. But now coming right back to behavioral health as a whole, why is it important? First of all, as an employer, it is 100% the right thing to do. People spend a large portion of their lives at work or thinking about work. And on the financial side of the coin, as Dr. Gilkey shared, there are costs associated and productivity losses when folks are dealing with issues. And I really like to stress presenteeism because that means you're at work, but you're not working. So think of any time you've been, in the office or on your job site and you're stressed out and thinking about a child at school or something like that. You're not all the way there. That could be a safety concern. It's certainly a productivity concern. But for us at Northern Light Health, it's way more than just the financial side of the coin. We want our employees to be at their best at work because when they're here, we want them serving our communities and our patients and giving those folks their best every single day. So I don't think it's a surprise to anyone to hear that, the psychological fallout from the pandemic is unlike anything that most of us have ever seen. So as a Northern Light Health leader with responsibility for providing health and welfare benefits for our employees, I didn't need data up front. I just knew that we needed to act. So in the beginning of the pandemic, we really leaned to indirect supports. An example of that is, folks with a low paid time off balance. Lainey, can you switch back onto the slide? Thanks. We would let them go into negative PTO and continue to pay them their full salary so they didn't have that income related stress. And then we moved to more tactical approaches such as teaching folks about practical steps for healing and coping after dealing with trauma. And in 2021, we formed the Wellbeing Collaborative, which taps into expertise from folks across our system to make sure our supports are well-rounded and meeting a wide variety of needs. This also helps cut down on duplication since we have a lot going on at any given moment. Now we'll look at some of our programming. Next slide. Thanks. I won't read all of this, but what I want to stress is that this is cumulative. So it shows how pre-pandemic we definitely had some things in place. And then as time has gone on, we've added more and more. And starting in 2021, when we were able to take our breath a little bit and really start focusing on what we're delivering for our employees, what I want to call out here is that we approach this in a couple different ways. So we have quick hit type of things that happen weekly. So something that might take 5 minutes twice a week, or a self-guided reflection that you can read once a week. We also have things that require a little bit more participation. Those are more monthly and quarterly programs. And then what I really want to stress is the true programmatic implementations that we have made as far as our benefits offerings. So as Scott talked about earlier, coming up, we will be expanding our EAP to cover more visits. We will be implementing a no-cost supplemental telebehavioral health offering in the new year to, again, help with those access issues that we're seeing around the nation. And then in the middle of this year, and probably not too many of you manage benefits, but if you do, you know that when you change your benefit structure mid-year, it is not an easy thing to do. And we said we have got to do this for our employees. So Starting on August 1st, we changed our health plan design so that when folks have to see our own Northern Light providers for services, they don't have to pay a dime out of pocket. And if they have to go to an in-network provider, it's a $25 copay. And we have received a lot of positive outreach from our employees. That doesn't solve access issues, but it certainly does solve some of the monetary issues. Next slide, please. So this is where I'll be a little bit personal. First of all, I look at data all the time. I'm a very big data geek, not ashamed of that at all. It's a big part of what I do. I was looking at information for a board presentation, and this was in August of 2021. And we separated this out to peds and adults. So pediatrics would be anyone 18 or under. And if we look at the left-hand side of the slide, you see the yellow bar, right? So you see clearly in 2020, around that March, April, May, June timeframe, a huge spike in pediatrics receiving services for behavioral health. If you look at the yellow bar on the right-hand side of the slide, you see that we definitely had increased utilization, but never that great big huge peak. Now, staying to the right-hand side of the slide, you see the red bar in 2021. Right around the 1-year anniversary of the pandemic, we see that peak on the adult side. And if there was ever a gut punch for me in my life, it was looking at this data and at a micro level, thinking about my own team here at work. So the first year of the pandemic, we huddled remotely, every couple of weeks. We had divisional meetings. We did more than we normally do to keep camaraderie up and support our teammates. But then in year 2, we were still so head down and working hard, but it was, even as a leader for me, I was like, this is our new business as usual. Let's go. We got this. We can do this. But I realized I wasn't supporting them in a way that I should have. And this slide really showed me that. And then on a personal level, I stopped short and said, my word, I'm tired, I'm burnt out. I have guilt about not spending a lot of time with my kids over the last year and a half because I've been working so hard. And so I actually had some conversations with my boss, who was super supportive. I sought some services, through our EAP and that sort of thing, and was able to utilize what we offered to kind of level set myself back into this new normal, but in a healthier way. So I like to share this with people because here, not just my experience, but what we're really seeing in our population. And I don't think any of you need to, me to tell you that this is a hard time for folks. I mean, between financial struggles, food insecurity, a lot of social unrest on top of a pandemic that seems to never end. So you want to, look at your data, of course, your EAP utilization, review your safety practices, listen to your employee feedback and take it seriously, watch your behavioral health spend and utilization, and invest in your leaders so they're equipped to support your teammates. And again, you don't need data, you don't need me telling you any of this. Our employees need help. And right now, it can seem, overwhelming to, maybe implement to the volume of the work that Northern Light Health has done, because we may be a larger business than yours, or you may feel like you're struggling. Where do I start? I just suggest one step at a time. And the most important thing you can do is care about your employees, and caring about them is free. And if you care about them, they'll feel that. And I will tell you 100 times over, that's just the very first place to start, is saying, we care about you. How can we help?
Well, thanks, Jamie.
Yeah.
Awesome. Sheila Thibodeau will speak about how to know what the right mental health resources are to offer your employees. Sheila?
Thank you, Dr. Gilkey. So whether we're talking about communication, burnout, stress, life transitions, parenting, conflict, everyone has difficulties from time to time. And we believe it's in the best interest of the employee and the organization to provide early intervention to help with those curveballs that we know life will throw us periodically, whether that's personal or professional, individual, or organizational. Most employees and companies can resolve almost any problem with the right support at the right time. And we believe that our employee assistance can help. So in general, an EAP is really a set of services that's specifically designed to do a couple of things. First, to improve or maintain the productivity of a healthy workforce, and also to address that particular organization's business needs through some specialized knowledge that we gain through working with lots and lots of client companies, and also through expertise about human behavior and mental health. So I think it's important for employers to understand their return on investment. I know that's been mentioned a couple of times, but I'd like to speak specifically to that related to EAPs. It's substantial. A 2020 study found that return on investment for employers in the US ranged from 1 to 3 for small-sized employers, up to 9 to 1 for large-size employers. The results found cost savings ranging from about $2,000 up to $3,500 per employee using the EAP. For the 2020 study, the sample included over 35,000 employees in 26 different countries who self-reported outcomes after using their employer's EAP interventions. According to the Journal of Employee Assistance, when the data of almost 5,000 employee clients was investigated a few years ago, it was found that a company could get an average return on investment of over $10,000 in productivity improvements per year for each employee who used the EAP program. So this study also found that upon employees' completion of these programs, EAP absenteeism dropped by 32%, emotional well-being increased by 87%, and morale and motivation in the workplace improved by 51%. So generally, productivity in the workplace was found to have increased over 25%. Next slide, please. So we provide organizations with comprehensive employee assistance programming, training, support, and consultation to contribute to wellness and safety, increase employee engagement, and also to positively impact the bottom line. Individuals, couples, families, and organizations, as I mentioned, have challenges from time to time. And we have found that sometimes solutions are easier to come by if you have a little extra help from professionals such as employee assistance programs. Since the pandemic, our average utilization has gone up significantly. And in some of our client companies, we've actually seen an increase of 10% where employees are accessing their EAP benefit in the months following March 2020. So not surprising, we, as most people, needed to make some changes pretty early on in the pandemic and throughout the pandemic. But we moved quickly to offer telehealth services so we could support employees and employers in a safe way. We, prior to that, had been doing mostly face-to-face sessions. We also saw a sharp increase in individual sessions and also immediate support with people simply just calling us and saying, I need to talk right now. We needed to really pivot our trainings. So we offered resiliency trainings and stress management trainings, but you can imagine those took on a little bit of a different shade with the pandemic. So we offered resiliency, managing a remote workplace, de-escalation, and then as the pandemic moved on, we transitioned to trainings such as returning to the workplace and recalibrating or the next normal. Utilization has remained high since the start of the pandemic. a reflection of the importance, right, of having wellness and mental health supports for employees. So often we get calls from employees who are in tears because they have been on waiting lists for counseling for months without an appointment. Even though EAP is not long-term, being able to tell someone that we can see them that week or even the same day, or even be in the moment with them and say, sure, how can I help right now, can really help them feel like that they have a partner in their mental health and wellness. So I'll do a quick couple of quotes from one employee from one of our clients' companies. Basically said, EAP saved my life. She had talked to her supervisor about several things that had been happening for her. Things had piled on, and then she lost her best friend and she was burning out. And the work-life stress was very intense. So after this conversation with her supervisor gave her the EAP number. After several sessions, the employee got the support that she needed and the tools for both immediate and long-term changes that improved her mental health. Another quote from someone who we've worked closely with, a benefits administrator in the Portland area, said that the workforce staff is professional and knowledgeable, and they help make us feel as though they really care about our organization and our people. I highly recommend Workforce. And one other point I really want to make is that it's all local. We're right here in Maine. So I think it's critically important as well. Next slide, please. So in addition to EAP client companies, Workforce EAP's reputation has resulted in an ability to partner with the state of Maine's Strengthen Me program. Through this program, we've been able to bring support and training to over 7,000 healthcare workers and frontline workers across the state of Maine since February of 2021. As you can imagine, we are so honored to care for the individuals who care for our families and our community. Workforce has been providing services to employers for over 40 years. Our professional development and employee assistant program portfolio of services helps employers provide support and skills coaching to their most valuable assets, their employees. Our specifically designed programs are able to address a wide range of concerns, ranging from family and personal problems that can distract an employee from their job to departmental or organizational issues such as conflict resolution, team building, supervisory skills training. Workforce currently provides comprehensive training, assessment, interventions, management consultation, and critical incident support services to over 100 organizations. Workforce can be part of a comprehensive wellness accident prevention program. So next, I'm going to talk a little bit about Healthy Life Resources, which is another program. Which is another program that we have to offer, that we have several support services for employers. Mental health, we have mental health promotion and education, where we are able to do mental wellness assessments, and from those assessments, strategize what might be most helpful to keep employees healthy. We also have educational and consultation situations where we can work with employees or supervisors. There is an on-demand, 24/7 on-demand resource center that employers can opt into. And with that, we have a portal for employees called My Strength, where they can access several self-help tools. And also with this programming, folks can have an area where employees can schedule for therapy sessions as well. Mental wellness consultation is a big part of this program, where we can consult with HR and managers. Also, analytics related to health plan costs. So we can take a look at health plans, the costs, and determine what support services we might be able to offer that would support employees and ultimately reduce the costs of the plans. Coaching and navigational services. So we have some exceptional community navigators who are available to help employees find services that they need. It's a pretty tough system sometimes to navigate, and especially when we're not quite feeling ourselves, it can be extremely helpful to have these navigators help us out, and they're great at what they do. Dedicated therapy, again, some therapists who could be dedicated specifically to client companies, and then of course critical incident response services as well. Next slide, Looney. So I wanted to make sure that we had some additional resources here. I know I've talked quite a bit about workforce EAP, and you can see here on the slide how to reach us at 800-769-9819. Healthy Life Resources as well, where we can be reached at 973-6446. I also wanted to mention that Northern Light Beacon Health Wellness also has programs to support employees around their journey to wellness. Acadia Hospital has several programs, and I just want to highlight one of them related to substance use treatment. And of course, they can be reached at 973-600. They have multiple different services. And if anyone's in need of mental health or substance use treatment, certainly I think this is a great place to start. And then, of course, our main crisis line that services any person in the state of Maine. That's a 24-hour support line that's can be reached at 888-568-1112.
Well, thanks, Sheila.
You're welcome.
You've provided a lot of information for us today. We appreciate that. For this next segment, all our panelists will join on video for question and answers. Okay, we're set to go. So, Scott, this first question is for you. Cost is always a top of mind issue for owners and managers. How frequently do owners and managers ask you about the hidden costs of mental health, like absenteeism, presenteeism, and related increased workers' compensation claims?
Sure. When we start talking to our customers, they sort of recognize the cost or the burden of increased stress and absenteeism and presenteeism. And so we spend most of our time talking about solutions and not identifying the cost. That's generally, we find people come to us already recognizing the problem.
Mm-hmm. I see. So let's do a follow-up question here, Scott. So of the various offerings in the marketplace, which ones are employers reporting success with? Like what's working out there?
Sure. Sort of varies by team culture, or even, other things like average age. A younger workforce might be more comfortable with app-based programming. But to be honest, the most successful solutions are sort of a new category of programming out there. We call advanced EAP, but it's really what Sheila was describing, either through their EAP program or the Healthy Life Resources programming, really sort of taking away a 3-visit limit and replacing it with a solution to help people through their need, if it's 3 days or 3 weeks or 3 months. And really, that's what most of our customers are embracing as a solution that fits, of course, all across their population of employees, the younger and the older folks, or work at home or office based.
So that's sounding like managing an entire episode.
Yeah, I think as I've talked to different people that are developing content, I've learned that the programming has evolved from sort of let's help somebody for a couple weeks to let's help somebody for what they need. And I think that it's from what I've learned, a more comfortable space to provide care. I've learned that the traditional EAP model is not the most comfortable for the provider of care either, and Sheila might be able to expand on that. But it's been interesting to see programs expand, to beyond sort of a limit, just to sort of what people need.
So Sheila, Scott's describing like an evolution of EAP over time, and I think we all recognize one size doesn't fit all. Could you just like elaborate on some of that?
Yeah, I think we're in the middle of it, Dr. Gilkey. We're in the middle of the change. It feels a lot like what we went through with the pandemic, right?
Mhm.
We
We're in the middle of a lot of things, it seems like, right?
we just we paid attention and we listened and we pivoted when we needed to. And when employers are asking for something different, we have a responsibility to stretch or blend or pivot to whatever it is that they need. And Jamie gave an example of that earlier. We're working on exactly that within our own system right now. I'm not sure it's going to look different, certainly, than it did before the pandemic, and it's going to look different than it does today. We have to evolve with what the needs are for employers.
Mhm. Okay, well, thanks for that. A comment from one of our participants. I think the new mental health hotline, the 988 number, bears mentioning. And then,
Yeah.
yeah, go ahead.
Yes, I believe it hasn't been out very long, and it's going to be a direct link to specifically for mental health issues. So I think it's wonderful. It's been a long time coming, and I am going to add that to this slide. Thank you very much to
Okay.
whoever said that.
So you're going to add it to the slide in time for when people like get to look at the slide deck. They could use that.
Sure.
Excellent, excellent. Well, Aaron, thanks for that too. Um, I'm going to go down a pathway here of a question on COVID from our participants. What has to happen? What do the numbers need to look like in order for us to be in the endemic phase? And Dr. Jarvis joined a meeting with our state epidemiologist, so I'll take a shot at that one on his behalf. So the concept of endemic is where things become very predictable. That's really, I think, the key driver. It's not so much the numbers, although the numbers can give us some indication. If the numbers become sort of plateaued, stable, maybe there's seasonality like there is with flu. In the Northern Hemisphere, you expect it to go up in the fall and the winter. In the Southern Hemisphere, it's the 6-month flip side of it. You know, that's endemic at that point. So we'll be looking for where we no longer have conversations about unpredictable surges like we're seeing all too frequently. As I put Dr. Jarvis on the spot a little bit earlier in this about the fall winter, I think we all are kind of like thinking, well, there's going to be another surge, but what is it going to look like? You know, that unpredictability keeps us from the endemicity of it, you know. So the other part of endemic, besides being an epidemiologic term, we hope that there's some control at that point where, you know, we predict an annual vaccination, booster, et cetera, will protect us all to a large extent, like we do take the approach once again with flu. That's part of the answer to that question. So being endemic of itself is only partially significant. The real issue is when we can truly put COVID in the rearview mirror. What's next after that? Monkey pox. What's after that? Well, we don't know, you know, but there's a lot more to that story. So thanks for that question. Jamie, I have a question for you. So what can employers do to help employees overcome the stigma of mental health and engage appropriate services? And that comes from, I know we put a lot of energy into May with Awareness Month and all that. So give us some insight on like how do you help like destigmatize?
Yeah, you have to talk about it. And that starts at the very senior level. And I'll talk about our May program, but we have what we call town halls with Tim. Tim Dentry is our CEO. And our last town hall was focused almost exclusively on healing and decompression after we leave work. And for him to speak very freely and openly and take that much time in those particular sessions, that really sets a tone. The other thing is, as a leader, we really need to provide people the opportunity to be vulnerable. Give them permission to be able to speak to you. It doesn't have, you don't have to know everything about what's going on with them. But if I have someone that can come to me and feel comfortable saying, Jamie, this is just not a good day for me. I need to step away. That's so much better than kind of stuffing everything down and feeling like you have to plow through or pretend that everything's working out all right. So I think that permission to be vulnerable is huge. And then there's programming that you can do. And Dr. Gilkey referenced our program called Unshaming Mental Health. And all throughout May, we had employees come forward that were willing to share their own stories about their struggles, how they reacted to those or didn't react to those, and share a piece of their life with our entire global audience. And so then you're thinking, these are my colleagues, they're just like me, we all have these struggles. So it really starts with the top, but we really need to stop hiding when it comes to this. As we see, 1 in 4 folks struggle with mental health. So we need to do everything we can to get it to the forefront that, you're not alone, we're all in this.
Mm-hmm. Yeah, that's another example of we're in the middle of this, I mean, it's an ongoing process for sure. And there really is a lot of social norms that we have to overcome to deal with it. Jamie,
May I add to that,
oh,
please?
please, Sheila, please do.
So, I think it's also important that once we set the stage and foundation for what Jamie just talked about, and employees experience support around speaking out and feel that it's okay. And not only is it okay, but actually you get even more support. So I think that it's top down to start with, and then really through that personal experience of it being okay, one step at a time is really what will launch us away from that stigma.
Yeah, thanks for that insight, Sheila. Jamie, I have a question from our audience here. And between the two of us, we'll do our best with this one, okay? How are you seeing utilizing IT technology for mental health and end user satisfaction and productivity? Is there a connection between how companies are using their device fleet for well-being? So you're kind of close to that to a certain degree with our employee health plan, but recognizing your background's not IT.
Yeah, and I'm better at reading than hearing all those words. So I'm just reading it really quickly.
Oh, okay, sure.
Yeah. So, I mean, I guess the thing for me, I guess the best way that I can speak to this is that we need to leverage IT in order to kind of solve the access issue. Then the other thing is, we've rolled out a couple of apps over the last couple of years, and that gives folks the opportunity to self-serve when is convenient for them. And of course, it's always convenient to be able to tap into something on your phone. And then the second piece is there a connection between how a company is using the device fleet for well-being. I guess I can't really answer everything in totality, but hopefully where I started was a jumping off point. I'm not sure if you have anything to add, Dr. Gilkey.
Yeah, well, I think certainly well-being, I think it was maybe you, Jamie, that had mentioned the Northern Light Beacon Health Wellness. And that's done as a partial offering through technology, where you engage with the wellness coach, et cetera. So I think there's a lot of ways we're certainly looking at every opportunity to leverage that technology. I think we've brought in outside vendors that can help us with our diabetic population and such. So there are lots of ways to do that. Great. Well, thank you. So, Sheila, let's go down that pathway of the different EAP elements a little bit further. Okay, so I'm thinking of, there's a difference between an employer like Northern Light Health with 12,000 employees and say a restaurant that has 15, 20 employees. Help us understand, like, what is, pun intended, the menu look like for EAP services? Give us some more insight to that.
Sure. So we have 3 basic models right now, but as we talked a little bit about earlier, I think we really need to be open to where are we evolving to in the future. But generally, we have a comprehensive model that that has basically all the services that we offer, and then folks can use that, and an employer can use those as they see fit over time and whatever the need is. If someone wishes not to take that comprehensive model, we have a simple model that knocks off a couple of the services, but the costs, as you can well imagine, is reduced a little bit. And then for some employers, want something, but they really, can't afford it, can't afford something additional extra, and what they'll do is they'll take a fee for service model, which basically is a retainer model where we're their EAP, we're immediately there for them, and then they actually pay for services that they use. Depending upon how much they use, that may or may not be the most cost-effective model. So that's why it's so important that we talk about who the client company is, what they're looking for, what their employees' needs might be, and really customize that.
So one size does not fit all.
It does
Yeah.
not.
Okay, great. Scott, I have a question for you. So, and where I'm going with this question is to gain some insight for our audience in dealing with, some elements of the issues here. We know that COVID-19 has surfaced increased symptoms of anxiety and depression, quite overwhelmingly, in fact. Regarding this significant uptick, what are some common themes you are hearing from managers and owners? Frustrations, feelings of responsibility, desire to help employees, help us get into their heads. Like, what are they talking to you about that they want?
Yeah, a lot of our customers work really hard to develop their team culture that allows their organization to thrive. And their employees' mental health or stress has often shaken that culture. That high performing team is just magic, and when that team is not able to work together effectively due to mental health or absenteeism or working remotely, whatever it is, employers are quick to recognize that. Managers are quick to focus on it, and looking for resources available to make sure that everybody in their organization can thrive so they can get their team humming again. And
awesome.
that's what we're hearing. A lot of leaders don't express frustration. They express a problem that they recognize, and then they look for solutions to solve that problem. The goal is a thriving team again.
So really problem-solving thinking is going on. Okay, great. Awesome. We only have time for one more question, unfortunately. So Jamie, help me with this. I think actually Scott did a great segue into it. Speak more about the culture of caring that's driving Northern Light Health. What are some examples that capture this corporate commitment of culture of caring?
Yeah, I mean, this is something that I could talk about all day, certainly more than
1 minute.
1 minute, not even 3.
1 minute, not even 3. I have to have some of that at the
So
end.
we clearly have a commitment to developing our leaders. We're rolling out 360-degree leader evaluations because we believe that giving sound feedback so our leaders can grow is an incredibly important part of that culture of caring. We actually have culture of caring as part of our system goals, which includes high standards of service excellence and engaging a compassionate, respectful workforce. These all have KPIs underneath of them, so we treat them extremely seriously. We celebrated Pride Month here all throughout Northern Light Health, and we have been doing gender equity listening sessions and follow-up training for our leaders based on that feedback. So those are just a couple of examples in my 60 seconds you allotted me. Thank you, Dr. for that.
Well, full disclosure, I know you could speak an entire day on those subjects, not just another hour. But having said that, thanks so much. We've included some tools for you at the end of this presentation. Thank you all for joining us, and thank you to our panelists for sharing such vital information. I hope this hour helps you to successfully manage your workforce. Just a reminder, we will be emailing you a survey right after our conference. Please be sure to give us your feedback so we can continue to provide relevant information. Our next session will be on September 8th. After an update on COVID-19 and monkeypox, our main focus will be on a multifaceted review of workplace violence. We hope you will join us. We will send you the link for this session. We encourage you to share the invitation with your friends and colleagues. By working together to promote good health, we will be promoting good business. Thank you. Have a good afternoon and enjoy the rest of our Maine summer.